So this is why we created the next process that we will talk about in this webinar. We have clinical pathways for the diagnosis of plantar heel pain, but clinicians could benefit from a simple clinical pathway to help with their orthotic prescription or help to get the individual effect that we need at the correct dose. So this 4-step process is a clinical pathway for the prescription of our DOLA Pro orthotic range that considers the patient's footwear choice, foot type and biomechanics, presenting pathology and lifestyle factors to get an individual prescription. So this was created to help practitioners get the best use out of our range, the additions and the specialty covers available. So each of the 4 steps we're going to talk about covers a key prescription consideration that can help create a individual orthotic, so a prescription orthotic for your patient, but do it in a cost-effective way, time-efficient way, and avoids the need for a custom orthotics. Step 1, patient footwear. This is where you select the DOLA Pro style based on the footwear you want it to fit. This is often an orthotic consideration that is put last in custom prescription, but we want it first up, as fitting the shoes your patients want to wear is so important. It is vitally important for patient satisfaction, an aim we have with all treatment options, and patient compliance, and therefore orthotic effectiveness, as an orthotic not worn will never work. Often this step will guide the prescription variables that follow for foot type, pathology, and cover due to the footwear design constraints. This is something I see with podiatry students every day when given a prescription form. They go crazy, ticking every option, but they think about them in isolation. Yes, for a patient with general forefoot metatarsalgia, a 3 mm pour-on forefoot extension, a metatarsal bar, and a 3 mm super cushion top cover may all be good choices, but maybe not all together when you're trying to fit it into a court shoe. The orthotic design for a work boot versus a football boot for the same foot type, biomechanics and pathology will differ based on the design attributes of the footwear. These types of shoes differ in many attributes, but vital ones including the internal space, the pitch or drop, the toe box depth, and the plantar surface area and shape. The 4 styles in our range offer a solution for most footwear types and provide the base to apply further prescription variables and is step 1 in our process. The shape of all DOLA Pro EVA orthotic styles includes a medial arch, lateral arch, heel thickness, and heel cup characteristics, all fully reinforced with a flat plantar surface. They can be fitted to the patient and the shoe without the need for further reinforcement, ready for the addition of prescription variables for foot type and pathology. Step 2, foot type. This is where we add prescription variables to suit the patient's foot type or biomechanics. Foot type and biomechanics can be an etiology or a risk factor contributing to tissue stress or overload. An orthotic can be considered a load-altering device that looks to address these factors while weight-bearing, reducing load on symptomatic tissue or keeping stress within a functional range. In Step 2, prescription variables are recommended within the frontal and sagittal planes to be applied in addition to the attributes of the orthotic shells previously listed. The flat, reinforced plantar surface allows for easy intrinsic grinding for rear foot varus, medial, or valgus lateral posts, or the addition of wedges and razors. Let's apply Step 2 to the foot types that present to your clinic. For the neutral foot, the characteristics of the shell alone can provide the support required. While the patient's biomechanical assessments may be within normal limits, these patients may still present with pathology or symptoms due to other factors, including extrinsic demands of work or sport, poor footwear or sport-specific footwear, aging, or an underlying disease process. In this case, the architecture of the orthotic shell with its stable rear foot, its medial and lateral arch support, provides the load control needed. The pronated foot may have responded to treatment-directed testing, including strapping, medial wedges, or arch support, and may benefit from prescription variables that increase the medial orthotic reaction force, the dose and position of which can be altered to match the force required based on the manual supination resistance test and the subtalar joint axis location. These variables include a varus or medial intrinsic rear foot post grind, a rear foot varus wedge, or a medial arch pad. The plantar heel of the DOLA Pro allows for up to 6 degrees of varus or valgus rear foot post to be ground in, or the flat surface also allows the addition of an extrinsic rear foot wedge, both of which will provide medial orthotic reaction force for the pronated foot. A pour-on arch pad can also be applied to the dorsal surface to increase the arch support, in addition to the medial architecture of the orthotic shell. All of these variables are very commonly used for the pronated foot. The supinated foot may have responded to your treatment-directed testing, including padding, strapping, a lateral rear foot wedge, a lateral forefoot wedge, or some arch support, and this may benefit from prescription variables that increase the lateral orthotic reaction force or increase the foot orthotic contact to help with high pressures, the location of which can be altered to match the force or clinical effect required. These include a forefoot valgus extension, a medial arch pad, or a rear foot valgus or lateral wedge. A forefoot valgus extension can be applied to the dorsal or the plantar surface of the DOLA Pro, extending from the calc cuboid joint to the sulcus, and will provide a pronatory moment. This will help with lateral instability and promote a medial transfer for toe-off. A medial arch pad is often used to increase the height of the medial arch or adjust the high point position to match the foot morphology. This will create more orthotic foot contact through the midfoot and can alter the high pressures found in a cavus foot. The flat plantar surface of the orthotic is perfect for the addition of a rear foot valgus or lateral rear foot wedge. This can assist in a flexible supinated foot transition from an inverted position at heel strike. This can be combined with a forefoot valgus extension to form an eversion ramp. Sagittal plane function at the ankle and first MPJ are a contributing factor or etiology for many common foot pathologies. The addition of prescription variables for ankle equinus based on your ankle range of motion and lunge test, and first MPJ function based on the JAX test and functional hallux limitus can assist in sagittal plane facilitation during gait. A heel raise and a reverse Morton's extension addition are two of the most commonly prescribed variables to address a sagittal plane block that will be identified in your physical examination. After addressing the results of your foot type and biomechanical examination in Step 2, we move on to adding prescription variables to address any tissue stress or pathologies present in Step 3. It is the properties of the materials, the placement, and the dose of the additions that combine to reduce pain and reduce tissue stress. Remember, most of your patients present to your clinics with symptomatic pain. This table in Step 3 will provide an option for common pathologies that present to your clinic. It is also a table you can add or highlight your favourite prescription variables to help new clinicians or to get consistency of prescription across clinicians within your clinic. The final step of the process, Step 4, highlights the power of the selection of a specialty top cover to match the attributes needed by the patient. This is often an afterthought or based on colour. A range of cover options do exist with attributes that will add to the success of your prescription for your patient. Cover fit, cover feel, and cover function are key prescription choices for your patient. What type of activities does your patient do? What types of socks or hosiery? How much room do we have in the shoe? Do we need a 1mm, a 2mm, or a 3mm top cover? Could we benefit from a mid-layer, or do we have room? Are they an at-risk or high-risk patient? Do we need to consider shear force? Do they sweat? There are many orthotic cover options available with attributes that can be used to complete your prescription to match the needs of your patient in the final step towards the best orthotic prescription possible.